Most people notice varicose veins in a very familiar way. First, a few thin spider veins appear around the ankles or behind the knees, and they tell themselves it is just aging. Then the lines become darker, the veins become easier to see, and they start buying creams, gels, or home remedies that promise smooth legs again. Then one day, a vein begins to bulge. It looks twisted under the skin. The leg feels heavy by evening. The ankle may swell. And that is usually when fear begins. They visit a specialist, hear words like laser, stripping, injection, or surgery, and they think the problem is finally being handled. But then something frustrating happens. A year or two later, new veins appear again, sometimes in the same leg, sometimes right beside the area that was treated. And many people think, why did this come back? Was the surgery a failure? In many cases, the surgery did exactly what it was meant to do. It removed the damaged vein, but the deeper reason the vein became damaged was still there. I am Dr. Daniel Brooks, and today I want you to understand something very important. Varicose veins are not just a cosmetic problem. They are not only about ugly veins on the skin, and they are not simply a normal part of getting older that you must accept without question. Varicose veins usually mean the blood moving through your legs is struggling against pressure, weak valves, poor muscle pumping, swelling, or blockage higher up in the body. When you only treat the visible vein and ignore the system that created it, the body often makes the same problem again in a new place. But when you understand what is really happening, you can finally work on the cause, not just the surface. To understand this clearly, imagine the veins in your legs as soft tubes carrying blood back up toward your heart. Blood going down from the heart into the legs has help from pressure and gravity. But blood coming back up from the feet has a much harder job. It has to climb upward against gravity, from your feet, through your calves, past your knees, through your thighs, into your pelvis, and back toward the heart. Your heart does not directly pull that blood upward from the legs. Your body uses two main helpers. One is the small valves inside your veins. The other is your leg muscles, especially the calf muscles. Inside the veins are tiny one-way doors. These valves open when blood moves upward, then close quickly so the blood cannot fall back down. When these valves are strong, blood keeps moving in the right direction. But when a valve becomes weak, stretched, or damaged, blood slips backward and begins to pool. Pressure builds inside the vein. The vein wall stretches. Over time, it becomes swollen, twisted, and visible under the skin. That is what most people call a varicose vein. It is not just a vein that looks bad. It is a vein under too much pressure for too long. Your calf muscles are just as important. Every time you walk, climb stairs, rise onto your toes, or bend and straighten your legs, your calf muscles squeeze the veins like a pump. That squeeze pushes blood upward. Then the valves close to stop it from falling back down. This is why movement matters so much. The calf is sometimes called the second heart of the body because it helps return blood from the legs. When you sit still for hours or stand in one place without moving, that pump becomes quiet. Blood slows down. Pressure rises. The veins begin to suffer. This is why varicose veins are common in people who stand all day, sit all day, or move very little. Hairdressers, shop workers, cooks, drivers, office workers, nurses, surgeons, and older adults who spend long hours in a chair all face the same problem. The legs may look still from the outside, but inside the veins, blood is waiting for muscle movement that never comes. Day after day, the pressure slowly stretches the vessel walls. Now, what causes those valves and vein walls to fail in the first place? There are several reasons, and most people are only told about one or two. The first reason is pressure from above. Your leg veins do not end at the top of the leg. They pass through the groin and pelvis and continue upward through the abdomen. If there is pressure in the lower belly, pelvis, or digestive area, blood coming from the legs may meet resistance. It is like traffic trying to leave a small road, but finding the highway partly blocked. The traffic backs up. In the body, that backup becomes pressure inside the leg veins. This kind of pressure can happen during pregnancy. It can happen from chronic constipation and straining on the toilet. It can happen from heavy lifting while holding the breath. It can happen when the belly is often bloated, tight, or swollen. It can also happen when the diaphragm, the large breathing muscle under the ribs, becomes stiff from stress, poor posture, or shallow breathing. Many people never connect their belly, breathing, constipation, or posture with varicose veins, but the body is one connected system. If blood cannot drain freely from above, the veins below pay the price. The second reason is weakness in the vein wall itself. Veins are not hard pipes. They are soft living tissue. They need strong collagen and elastic fibers to hold their shape. Some people are born with more fragile connective tissue. These are often the people who had flexible joints when they were younger, sprained ankles easily, or noticed veins appearing earlier than others in the family. Genetics can matter, but genetics are not the whole story. Low vitamin D, poor nutrition, low intake of colorful plant foods, and long-term inflammation can all make the vessel wall weaker over time. The third reason is thick, slow-moving blood. Blood is meant to flow smoothly, but when a person is mildly dehydrated day after day, the blood can become thicker. It does not move as easily through small vessels. The veins have to work harder. Pressure increases. Many older adults do not drink enough water because they do not feel thirsty. They avoid extra bathroom trips, or they count tea and coffee as water. But the body still needs plain water to keep circulation moving well. Even mild dehydration can make heavy legs, swelling, and vein pressure worse. So the real plan for varicose veins must work on the whole system. It must support blood flow, reduce swelling, wake up the muscle pump, remove pressure from the belly and pelvis, and strengthen the vein wall. This does not mean every person can avoid medical treatment. Some varicose veins are advanced. Some need procedures. Some need urgent evaluation. But even when treatment is needed, working on the cause can help stop the same pattern from repeating again and again. The first step is to improve the way your blood flows. Start with water. Not soda, not juice, not coffee, not sweet tea. Plain water. A simple target many people can use is about 30 milliliters of water per kilogram of body weight each day, unless your doctor has told you to limit fluids because of heart, kidney, or liver disease. For many adults, that often comes out to around 2 liters or more per day, depending on body size, climate, activity, and medication. The point is not to force water dangerously. The point is to stop living in a dry state every day and expecting the veins to work normally. Coffee and tea are not evil, but they should not be your only fluid. Caffeine can make some people lose more fluid through urine. So if you enjoy coffee, simply add extra water around it. A good habit is 1 glass of water when you wake up, 1 before each meal, and 1 between meals. Older adults often do better with steady drinking through the day instead of trying to drink a large amount at night. There are also simple foods and spices that may support circulation. Turmeric contains curcumin, a natural compound that helps calm inflammation. Ginger contains active compounds that may support blood flow and reduce irritation in blood vessel walls. You can add a small amount of turmeric to warm food or make ginger tea by slicing fresh ginger, pouring hot water over it, and sipping it through the day. But this matters. If you take blood thinners, aspirin, have bleeding problems, have gallbladder disease, or are preparing for surgery, talk with your doctor before using high amounts of turmeric or ginger. Natural does not always mean safe for every person. The second step is to reduce swelling in the legs. Many people think swelling is only a separate symptom, but swelling makes varicose veins worse. When the tissue around the vein fills with extra fluid, it presses on the vein from the outside. That makes blood movement harder. Then the vein becomes weaker, the pressure rises, and the swelling can become worse again. It becomes a loop. Food often plays a major role in swelling. Sugar is one of the biggest hidden drivers. When you eat a lot of sugar and refined starch, your body stores some of that energy with water. This can make tissues feel puffy. Sugar also feeds inflammation, which is bad news for blood vessels. The problem is not only candy. Many people over 50 are eating sugar without realizing it through fruit juice, sweet yogurt, bottled sauces, breakfast cereals, white bread, biscuits, and packaged snacks. A drink that looks healthy can still carry a heavy sugar load. Highly processed foods can also make the legs hold fluid. Chips, instant noodles, packaged soups, frozen meals, fast food, salty crackers, processed meats, and flavor-enhanced snacks often carry large amounts of sodium and additives. Sodium pulls water with it. When the body holds extra water, the ankles and lower legs often show it first. If your legs are swollen by evening, look carefully at what you ate that day and the day before. The answer is often hiding in the kitchen. For some people, dairy may also contribute to puffiness or inflammation, especially if they are sensitive to it. This does not mean everyone must stop dairy forever. But if your legs are always swollen and you cannot find the reason, you can discuss with your clinician whether a short dairy-free trial makes sense. The body often gives honest feedback. If swelling improves, you have learned something useful. If nothing changes, you can move on without guessing. Now let us talk about what to add. Fresh foods with high water content can support fluid balance. Cucumber, watermelon, celery, parsley, berries, citrus fruits, and leafy greens are simple choices. Cranberries and similar tart berries may support urinary flow for some people, but avoid sweetened cranberry juice because the sugar can cancel the benefit. The goal is not a fancy diet. The goal is less processed food, less sugar, more water-rich foods, and steady hydration. The third step may be the most important of all. Activate the leg muscle pump. Remember, the veins in your legs need muscle movement to push blood upward. Resting all day may feel safe, but too much stillness is one of the worst things for varicose veins. Many people with vein problems are told to elevate the legs, and elevation can help symptoms. But elevation alone is not enough. Your legs also need gentle, repeated movement. There is a common fear that exercise will make varicose veins worse. Heavy lifting while holding your breath can increase pressure and may worsen symptoms for some people. Long, hard running on concrete may not be ideal for everyone. But controlled walking, calf raises, gentle squats, ankle circles, and regular movement are not the enemy. They are part of the treatment. The body was designed to move blood through moving muscles. A simple routine can be done several times a day. Stand near a chair or wall for balance. Place your feet about shoulder width apart and slowly rise onto your toes. Hold for a moment, then lower down slowly. Do this until the calves feel warm or mildly tired. That feeling means the pump is waking up. Then do gentle squats if your knees and balance allow it. You do not need to go deep. Just bend the knees slightly, keep the back comfortable, breathe out as you stand, and never hold your breath. Then walk for a few minutes. This alone can make the legs feel lighter because blood and fluid begin moving again. If you sit at a desk, get up at least once every hour. If you cannot stand, move your ankles up and down while seated, as if pressing and releasing a gas pedal. If you stand for work, do not stand frozen in one position. Shift weight, rise onto your toes, take small walks, and use the calf muscles often. Still standing is not the same as movement. The veins need squeezing and releasing. Walking is one of the best medicines for varicose veins. A daily walk of 30 to 40 minutes, even broken into smaller sessions, can improve heaviness, swelling, and circulation over time. You do not need to walk fast. You need to walk consistently. If you can take stairs safely, stairs are excellent because they force the calf and thigh muscles to work. Every step is a small pump stroke sending blood upward. The fourth step is to look for mechanical pressure higher up in the body. This is the part most people never hear about. Blood from the legs travels through deeper veins behind the knee, through the thigh, through the groin, into the pelvis, and then upward through the abdomen toward the heart. Along that path, pressure from the bowel, pelvis, liver area, or tight breathing muscles can make drainage harder. Chronic constipation is a major issue. When you strain on the toilet, you increase pressure in the belly and pelvis. That pressure pushes down on the veins. Over time, repeated straining can worsen varicose veins and hemorrhoids for the same basic reason: too much pressure in the wrong direction. If you have varicose veins and constipation, do not ignore the constipation. It is not just a digestive problem. It may be adding pressure to the entire lower body circulation system. Bloating can also matter. A belly that is often full of gas or tightness can create pressure around the pelvic vessels. The answer is not to panic, but to notice patterns. Do certain foods bloat you badly? Do you go days without a proper bowel movement? Do you sit hunched forward most of the day? Does your breathing stay shallow in the upper chest instead of deep and relaxed? These things may sound small, but over months and years, they change pressure inside the body. Gentle belly massage may help some people with bowel movement and abdominal tightness, but it should be done carefully. Slow clockwise massage around the belly can support bowel movement because it follows the natural direction of the colon. Gentle breathing exercises can also help the diaphragm move better. Try breathing slowly through the nose, letting the lower ribs expand, then exhaling fully without force. When the diaphragm moves well, it can assist blood return from the lower body. But if you have abdominal pain, a hernia, recent surgery, unexplained swelling, pregnancy, cancer history, or any serious medical condition, do not press deeply into the abdomen without professional guidance. The fifth step is to strengthen the vein wall. Vein walls need nutrients. They need collagen support. They need less inflammation. Vitamin D is one important piece because it plays a role in tissue repair and vessel health. Many adults, especially older adults who spend little time in the sun, may have low vitamin D. The right way to know is with a blood test. Do not guess. If your level is low, work with your doctor on the right dose, because too much vitamin D can also cause harm. Colorful plant foods are another important piece. Berries, citrus fruits, cherries, dark grapes, buckwheat, leafy greens, and other colorful foods contain plant compounds called bioflavonoids. These compounds help support the small blood vessels and may reduce leakiness and inflammation in the vessel wall. This is one reason a diet rich in plants can help circulation. It is not magic. It is raw material for repair. Now, let us talk about compression stockings, because many people ask about them. Compression stockings can be very helpful. They gently squeeze the legs, reduce swelling, support surface veins, and often make the legs feel less heavy. They are especially useful during long travel, long standing, or after a doctor recommends them. But compression is support. It is not a cure for the cause. When you take the stockings off, the same pressure problem may still be there. So use them wisely, but do not let them replace hydration, movement, swelling control, and medical evaluation. Surgery and vein procedures also have their place. Laser treatment, vein closure, injections, and removal procedures can help many people, especially when veins are painful, advanced, bleeding, causing skin changes, or not improving with conservative care. There is nothing wrong with needing a procedure. The mistake is thinking the procedure automatically fixes the system that created the vein problem. If the muscles are still inactive, the blood is still thick from dehydration, the diet still causes swelling, constipation still increases belly pressure, and the vein walls still lack support, then new veins may appear later. This is why the best approach is not surgery versus natural care. The best approach is understanding timing. Build the foundation first when possible. Improve circulation. Reduce swelling. Move the legs. Support the vein walls. Address constipation and belly pressure. Then, if a procedure is still needed, the results may last longer because the body is no longer fighting the same old battle every day. There is also one fear we must discuss clearly: blood clots. Many people with varicose veins worry that a visible vein will suddenly send a clot to the lungs. The truth is more specific. Varicose veins are usually surface veins. A clot in a surface vein can cause pain, redness, warmth, and hardness along the vein. This can be serious and should be checked, but it is different from a deep vein clot. The most dangerous clots usually form in the deep veins, especially after surgery, long bed rest, cancer, serious illness, injury, or long travel without movement. Here is what you should never ignore. If one leg suddenly becomes much more swollen than the other, if there is deep calf pain, warmth, redness, sudden shortness of breath, chest pain, coughing blood, or fainting, seek urgent medical care. If a varicose vein becomes hard, red, hot, and painful, contact a doctor the same day and ask whether a vascular ultrasound is needed. Do not sit at home guessing. Fear is not useful, but quick action is. After 50, varicose veins can progress faster. In women, hormone changes after menopause can affect vessel elasticity. In both men and women, muscle mass often declines with age. Less muscle means a weaker leg pump. Less walking means slower blood return. More sitting means more pressure. This is why a vein problem that stayed mild for years can suddenly seem worse in the 50s, 60s, or 70s. The body is not betraying you. It is asking for a different level of daily care. So here is the plan in simple terms. Drink enough plain water throughout the day, unless your doctor has restricted fluids. Reduce sugar, processed foods, and salty packaged meals that make the legs hold fluid. Add freshwater-rich foods, berries, greens, and colorful plants. Use ginger or turmeric carefully if they are safe for you. Move your calves every hour. Walk daily. Do gentle calf raises and safe squats. Avoid holding your breath when lifting or standing up from effort. Treat constipation seriously. Breathe deeply enough to let the diaphragm move. Check vitamin D if you have not done so. Use compression stockings as support when needed. And see a vein specialist if you have pain, skin darkening, sores, bleeding veins, sudden swelling, or signs of clotting. The most important message is this: varicose veins are not just a skin problem. They are a circulation problem, a pressure problem, a muscle pump problem, and sometimes a whole body habit problem. When you only chase the vein you can see, you may miss the cause you cannot see. But when you work on the system, you give your legs a real chance to feel lighter, drain better, and stop getting worse so quickly. You do not have to accept heavy, swollen, painful legs as your normal future. And you do not have to wait until the only option feels like surgery. Start with the simple things that change pressure every day: water, walking, calf movement, less swelling from food, better bowel habits, stronger vessel support. These steps may look small, but done every day, they change the environment your veins are living in. And for many people, that is the difference between veins that keep getting worse and legs that finally begin to feel alive again. I am Dr. Daniel Brooks. If this helped you understand your legs in a new way, subscribe to the channel and share this with someone who complains about heavy legs, swollen ankles, or visible veins. A few simple changes made early can protect mobility, independence, and comfort for years to come.